Hello, my name is Tom Fox, and I'm here with Research Rundown. Today we're going to look at cerebral palsy and some of the studies that are out on cerebral palsy. One of the studies was a Montreal multi-center trial that was done and completed in 2001, and it changed the view of cerebral palsy and the care of cerebral palsy. I want to mention the doctor that was instrumental in making this thing happen, and that was Dr. Pierre Marois. Dr. Marois is a physiatrist that is based out of Quebec. He sees about 90% of the children that are born with birth injuries like this. And the interesting thing about him is that he's participated in 3 different studies, and 2 of the studies that I'm presenting today, he will be I'll be talking about his role. The first one that I'm talking about is a study that was completed in 2001 by Dr. Collet. Dr. Collet actually looked at based on 4 centers, they looked and collected information on 111 children with cerebral palsy. In this result, what they did was they compared, and this is often referred to as a randomized control trial. It was not a randomized control trial, it was a dose study. It looked at 2 doses of hyperbarics, both hyperbaric air and hyperbaric oxygen, and compared them to each other. In that, starting from baseline, both groups improved. Both groups improved significantly. That means the quality of life in both groups improved significantly. They saw improvement in gross motor function, fine motor function, reduction in spasticity, reduction in custodial care time, and also improved cognition. This is interesting, but it was referred to as a negative study, and those individuals that have written about it since then have only read the abstract and said, hey, it was a negative study. Well, they aren't exactly true, and they haven't looked at it. And they haven't looked at it in the context of universal health care, and that's where it was done in Montreal. One of the things that's interesting about it is that the individuals that improved, and both groups improved, the ones that were perceived to be a control, that recently has been invalidated as a control and proved to be a metabolically active arm of the study. That's kind of set everything on its ear. The thing that's interesting about this study too is that in a universal health care uses health care to return people back into the workforce to pay for the system. If you're not going to return to the workforce, then it's not a prudent use of hyperbarics, even though it saves a lot of money for the government. There are a lot of individuals and a lot of children that have this injury and would benefit from it, but the quality of life at the end, they'll still have cerebral palsy, but their quality of life would be tremendously improved. While that's a parental desire, it's not seen by the government as being an effective expenditure of funds. For that reason, this study generated actually came with a compromise. Hyperbaric oxygen in the delivery of neurological conditions appears as a by name item in the Quebec tax code for reimbursement or for a deduction. So that's the only therapy that appears in the tax code. So I guess that is a win-win situation for everybody involved.